Good morning, good afternoon, good evening, everyone. You're welcome to today's episode of Public Health in Real Life, a channel where we aim to highlight key global health issues, celebrate unsung heroes from the field, and inspire the next generation of global health leaders. August is Breastfeeding Awareness Week, and specifically the week of August 25th to 31st is Black Breastfeeding Awareness Week, which was created to highlight and raise awareness of the specific challenges that Black breastfeeding parents face. And this year, incidentally, marks 10 years since the launch of Black Breastfeeding Week. And it was specifically created based on five major reasons. That one, understanding that Black babies face a disproportionately high mortality rate. Also, that Black families experience high amounts of disease related to nutrition, that there aren't enough people of color in the lactation field to support Black parents, and that Black parents face specific cultural barriers to breastfeeding success. In addition, many Black parents live in vulnerable communities and lack community support for breastfeeding. And as we all know, it is well established that breastfeeding supports optimal maternal and child physical and mental health. It also provides important social and economic benefits for mothers and babies during the postpartum period. To support me on this interview today is my co-host, Faisa Ali. Faisa, welcome to the show.
Thank you for having me. Thank you so much. My name is Faisa Ali. I work for the communications at the Center of Black Maternal Health and Reproductive Justice at Tufts University. I also work for communications for a maternal health startup promoting midwifery care. So I'm very honored to be on the program today. We have Dr. Nakeitra Burse, who established 6 Dimensions LLC in an effort to strategically respond to the health needs of communities. 6 Dimensions is a woman-owned, minority-owned public health research and development practice agency focused on supporting better health outcomes for all people and communities by creating strategies that address systemic inequalities. So, as a native Mississippian, she is well aware of the impact of poor health on the environment, the economy, and overall quality of life of individuals and communities. She's also acutely aware of the impact that systems have on individual and community health. Dr. Burse has been entrenched in public health for about 10 years, earning a BS in biological sciences and an MS in health education and health promotion, both from Mississippi State University. She's a proud Mississippian. She also holds a doctorate in public health from Jackson State University. In her early career, Dr. Burse was a personal trainer and boot camp instructor and still enjoys physical activities, but without the pressure of teaching. Dr. Burse loves traveling and spending time with her husband and 2 sons. She also enjoys learning and trying new hobbies such as crafting on circuit maker. Cricket maker, circuit maker. I think so. And then we have Libby Bunker, who is a maternal health research and evaluation fellow, and is also right now a doctorate candidate in the John Hopkins Bloomberg School of Public Health with a concentration in health equity and social justice. Her research interests are in maternal health and the intersection with community and global health. Libby previously served as a senior director at a global NGO supporting surgical service delivery programs, pilot health systems and initiatives, and medical training in 30 plus low and middle income countries. She also received her Bachelor of Arts from the University of Dayton and her master's in public health from George Washington University. She resides in Virginia Beach with her husband and small daughter and 2 German shepherds. So thank you so much and welcome to the program.
Thank you for having us.
Yeah, we appreciate being here.
You're on mute.
So right to the business of the day. Apologies for that snafu. Libby and Nakeitra. So like we mentioned previously, about the disparities with Black breastfeeding parents. Black women are impacted disproportionately due to systemic racism that then increases health inequities, worsening maternal and infant health outcomes. So, Nakeitra, could you expand on the different ways that systemic racism impacts Black breastfeeding mothers specifically?
Yeah, and I always like to draw these things to our history, particularly as Black women. When we look at the breastfeeding rates, everyone will tell us that, Black women don't breastfeed at, the highest rates. And I think some of those rates, the gap, I think between Black women and Asian women is like 17%. And so looking at that number, even though, the rates for Black women to me are significantly high, around 84% maybe. But I always link it or think about history because we can't remove that from where we're going in this. And so if we look at the history of wet nursing and how, Black enslaved women were not able to really nourish their own babies during that time. They were required to nurse the slave master's baby. And so when we think about that and think about as we progress in history, move from enslavement and how we may often disconnect from that practice because of the trauma and then that gets passed down generation after generation. I always say that there right now are 5 generations living in my family. My great grandmother is living and she is 92 years old. And I never heard about breastfeeding in my family until I had a cousin that breastfed her child. And my mom would say, well, I just never even thought about it. And so though I didn't hear those stories about why maybe my grandmother nor great grandmother breastfed, I always wonder what historical impact enslavement had on my family and other Black families. And so that's one big piece of this kind of system. And so we developed this narrative around, well, Black women just don't breastfeed. There's also literature that says that Black women, may, as we progressed in society, formula may have been like a sign of like socioeconomic status, which potentially could be. I'm not discounting that study. I do believe that there is some piece to that, but I also believe that the history of the trauma is the biggest component. And so then when you go into a healthcare system that may not often value your body as a Black person, and then you say, well, I want to breastfeed, but formulas continue to be pushed on you. I think that also goes within the society of, capitalism that we live in and then it's hard that patient and provider disconnect in that power hierarchy or, even the system. So to say, well, no, I want to breastfeed my baby, but if someone is pushing that on you, especially if you're in a vulnerable situation, then that may be hard. And so I think about like those very overt and one-to-one instances that have an impact. But to me, it's really the historical implications that continue to be passed down from generation to generation without good conversation around that trauma.
Thank you so much, Nakeitra. So Libby, you work in, health workforce development, and especially in like the global surgery field, but then bringing some of those skills and experiences to this is, how do you think a shortage of Black lactation and breastfeeding specialists in our communities affects sustained education and promotion activities? And, could you also expand on other challenges that Black mothers face in accessing maternal care?
Absolutely. I think that's a great question because I think, a lot of people try to say, why don't women, like Dr. Burse was just saying, why don't women just breastfeed? And I think what has been found so far in different studies and just also from patient perspective is having Black lactation consultants or other Black medical providers can provide a cultural bridge for Black families and understanding the historical trauma, the fears and challenges with breastfeeding. They can help to navigate the social and mental and physical spaces and relationships within birthing culture. And if that's missing from a hospital setting, when, breastfeeding is first initiated, it can delay, a woman or a family's decision to decide to breastfeed. And so having that first initiation and touch point is really critical. And so without that, again, it can make it more difficult for women to initiate breastfeeding or continue the practice if they don't have other advocates for them in that space to understand and, to have conversations with other medical staff. And in general, hospitals and healthcare providers are less likely to discuss breastfeeding options with Black families. There is a big push for formula. So again, if we have, a disproportionate number of Black lactation consultants, Black OBGYNs, nurses, or other providers that can provide that bridge and support and advocacy for our patients, they might be less likely to even hear about or receive education in a hospital setting about breastfeeding. And there's just also a lack of access for training opportunities for Black lactation consultants right now too. So that really needs to be a shift. If we want to see more, we need to consider how do we have more training programs for lactation consultants and specifically to recruit Black lactation consultants in the profession. There have been thoughts and some opportunities to increase cross-training for doulas or for midwives, social workers in this space to also have that lactation certification. And that's really important to try to increase the human resources available in the field. But your second question about, the barriers that Black mothers face are disproportionate compared to the white community when it comes to breastfeeding or maternal health care as a whole. There's challenges in terms of geographic access to service, lack of coverage and postpartum support, and also just protection in the workplace to even have, the right or the opportunity to breastfeed that make it more challenging. So you see a lot of, issues around acceptance and also accessibility. And I think just, a few things I wanted to touch on with that. In the United States, there's over 1,000 maternity care deserts. And so a maternity care desert is a place where there's no obstetric providers, hospitals, or birthing centers. And looking at Mississippi as an example, over 75% of birth parents of racial minorities live in maternity care deserts. So when you start looking at, that lack of access for women to even find an obstetric provider, how are they going to find, the means of continued support for breastfeeding? Because it's really, not a singular interaction or touch point, but it's a journey. And we have to think about, opportunities for women to have that coverage and support more than just in a hospital setting.
That's very important. And it just reminds me of, I come from African origins, I'm Somali, and we do have that, that generational support to give access and also education and pass that along from generation to generation. So, Nakeitra, I ask you, African American women often lack that multi-generational support and encouragement from like their mothers and grandmothers to breastfeed. What do you think is the reason and the origin of this, and how is it affecting mothers today?
Yeah, I think it's this society that we live in its current form, because, like I said, I mentioned enslavement, racism, all those things. And so that really has done a lot to our support system as families. And so, and I don't think that it's that families don't want to support. I don't think that it's about, but understanding and everyone in the family knowing and being educated on the support that a mother needs for breastfeeding. And so a lot of that, because, and I would use myself for example, but just a lot of that thinking about even my experience when my mom said, well, I didn't know anything about breastfeeding, but I continued to educate her and talk to her about it. And definitely an amazing support for me And even my sister, who had a NICU journey, my mother was very supportive of that as well. And so I think because we have been disconnected or disjointed from that in so many ways, maybe those of us that are moving into, continue in this space and continue to breastfeed, I think it's up to us to continue the education, provide the support that's needed for families, because it is breastfeeding is definitely a hard and a full-time job, and so without having the proper support, it's very easy to not, to just let the journey go. And even when it comes to like going back to work and thinking about how do I go back to work in this if I don't have a support system at home. And so that's very critical. And I can remember when on my first breastfeeding journey, I left my baby for a night, like with my family. And I left the breast milk. I left the amount of breast milk that they needed. And they called me. They were like, I'm about to go get some formula. This baby is hungry. And so I think it's those kind of generational things that happen in the Black community. Like, we need to feed the baby, and you're not giving the baby enough milk. And so those are some of the things that we hear play out in the community as well. Like, well, I couldn't produce enough milk, or I didn't have enough milk supply, or I couldn't. And so that support there would say your body, just to say your body is doing what it's supposed to do, that reassurance could be critical, And so even in that kind of family situation that I just mentioned, if I hadn't said, he is just fine, the milk that I left you is just fine, don't give him any formula. But, in that push and pull, it could be a critical moment. And so being able to provide that support, and just like, even, I know it's very hard as breastfeeding mothers, but as we continue to educate ourselves, educating our family, so we can bring the tradition back around and continue to pass it on.
You really spoke to me when you're talking about just the difficulties of breastfeeding, and even through my mom. My mom, when I first had my kid, she would just say, this baby's hungry, and push formula until my milk supply started to go down. And I'm just trying. It just related to the fact that we were immigrants, and my mom didn't have that education from her mother and her grandmother, and then that passed down to me. So I really do have a personal interest in this. Do you think this, like the breastfeeding journey and the lack of support, immigration has an impact on it?
I do think, like, when we read about maternal health outcomes, and when we look at like immigration and like even the family structures that, and I say my ancestors or descendants had, in the resources that you're talking about, the support, that you say your family had, but when families come to America, those Black maternal health outcomes tend to still be the same when it comes to Black women. And so that makes me just think, it just drives home the point of like, much of this is systemic. And even when you have that support and come to a country that does not kind of support that model, then you're still in the same bucket of all, kind of all of us Black and brown people, which is very horrific. But I will say, I sat in on a doula training with the Black Women's Health Imperative, and the model that they were using was an African model of care, like of providing support, and like this communal system of support for the mom after giving birth. And I was just mind blown, amazed, and almost thought about being a doula. And I changed. I'm not, but I always say doula is not for me. But that communal model, I was just thinking, like, if we continue to have that and have that shared here in this country, and just thinking about our roots and bringing it back to kind of our ancestry and lineage, I think that would be so like have such a big impact on our outcomes outside of the system.
Right. Thank you.
Yeah, that's definitely eye-opening. And from a cultural perspective, Nakeitra, what role then do Black men and people, fathers in the community, barbers shop, and all of those cultural kind of like touch points play in raising awareness on breastfeeding? And also, I think importantly, the literature also talks about desexualizing breastfeeding.
Yeah, I had a conversation maybe a year ago, and I'm not sure if anyone's familiar with Mama Shafia Monroe out of Portland, out of Oregon. And so she always says, don't leave out the man. Don't leave out the partner, don't leave out the spouse. And I think, again, in the way society is constructed now, particularly for Black women, Black men have a very significant role to play. We're in a space where the family structure has been just obliterated in some manner through this system. And so having that spousal support, that partner support, that can speak up and has an understanding to be able to advocate on behalf of a woman is critical. And I even think about that even in the space of just going out in public. The crazy looks that mom might get, particularly a Black woman, when she's breastfeeding in public, having that type of security and support from a partner is important. But the desexualizing and being able to have those conversations in the barbershop. So as y'all can see, I go to the barbershop. And so, I often sit, I don't really talk when I'm getting my hair cut, but I listen to the conversations that are happening. And my barber was one that hosted vaccine workshops, was a part of an initiative around blood pressure. And he also has books in the barbershop. So that speaks to like 3 areas of like health and support that barbers can promote. And that's so critical. And being able to, really take away that stigma and talk about it in a way that's very open and honest so that they can support their partners and other women is so critical. And my barber even just had a baby, and I did mention, hey, is mom breastfeeding? And without being invasive. But I think just having those very small conversations in a normal way is so important, and it translates over.
Yeah, and just to add to that too, I think, one of the biggest indicators for breastfeeding success, because I think a lot of times, the focus is on initiation of breastfeeding. But again, I think we've really talked about that breastfeeding is a journey. The American Academy of Pediatrics now is recommending up to 2 years of age for breastfeeding. And that's, not attainable for all families, but we have to think about not just initiation, but continuing that journey and promoting, in whatever methods are best for a family. But social support is one of the biggest indicators of having a successful breastfeeding journey. So again, working to really get a father or a birth partner involved is critical to just remove, as Dr. Burse said, the stigmas, but any of the shame associated as well. And I think the other piece of that too is men need to be advocates in the workplace for having, breastfeeding friendly spaces or, allowing women to have time to go and pump during the workday. So I think, Black men and, men in general have a huge role in playing, how society perceives breastfeeding. So those are just a few things I wanted to add to that as well.
Thank you. We talked a lot about challenges from systemic racism to lack of access. So I'm going to shift our gear to solutions. So in hitting the bullseye, how can we address some of the main root cause of the issue? So I'm asking you, Libby, how can we encourage breastfeeding versus formula? Or how do we increase Black health of professionals or Black health of professionals. So how do we do that?
Yeah, I think this isn't a simple answer by any means, but I think we have to consider it in three parts. So I think there need to be solutions at a policy and systems level. So really thinking about, overarching macro level solutions that trickle down to support community level engagements and then the individual. So in considering policy and systems, I think first we need to think about the challenges in access for Black women in terms of maternal health care. So making sure that women have adequate insurance, adequate postpartum coverage is critical in promoting a Black breastfeeding journey. If women, are uninsured or underinsured, that might be a terminating factor right there. So I think, really continuing to work with each state to increase postpartum Medicaid coverage from not just ending at 6 weeks, but hopefully going for that full 12 months could increase, a lot of maternal health outcomes, including breastfeeding. I think with that as well is looking at paid parental leave. So a lot of, Black families and other racial minorities do not have that luxury. So, looking at the American College of Obstetrics and Gynecology recommends that, every employer should give 100% or full pay for a minimum of 6 weeks. And so if that was a reality, that could also really increase opportunities for women to, have, the postpartum healing they deserve, but also give them time to, figure out those next steps around a breastfeeding journey within the workplace. Lactation discrimination can be widespread, and this is, more often seen in lower wage earning brackets, which often impact, Black women and families. So I think, from a systems or policy level, those two changes are really critical. But in addition to that, I think it's really working with universities and other training programs to increase, specifically maternal health training programs for Black women, whether it's through doulas, lactation consultants, midwives, and also, again, looking at cross-training elements. I think in a lot of communities, if there's a very low number of doulas and an even lower number of Black doulas, ensuring they have a broad range of skill sets is critical. I think, the lactation field has been heavily medicalized, which in some ways is good, but at the same time, it decreases opportunities for access through home visit programs or lactation services at a community level, which may be more comfortable or culturally appropriate for the Black community. So I think, considering how we can train, lactation consultants in other positions outside of the medical profession is critical. I think, Dr. Burse brought up some great points earlier around, how communities are so involved in, low and middle income countries in the maternal health and postpartum experience. And I think adopting some of those interventions as reverse innovations in communities in the United States could have a huge impact in how we reach women and how we reach families, with better breastfeeding support at an easier touch point. A lot of medical and Medicaid coverage right now doesn't include lactation consultants or services through home visiting channels. It's only at a hospital touch point. So if we look again at, the number of maternity care deserts in the United States and the lack of hospitals and obstetric providers, if that's a woman's only touch point to lactation services, it might be really out of reach for her to continue getting that support. So I think we have to think about that as well in solutions. And then at kind of that community individual level, I think we've talked about this through increasing, Black male support, educating families as a whole, but really working to communicate and train community advocates can be a critical opportunity. So making sure that there's people within the community that can encourage, reach out in a non-invasive way to support, whether, it's in having discussions around whether a family wants to breastfeed or not, or just even, being there for physical or mental support along the way. There's been a lot of studies too around the use of social media and virtual spaces to encourage breastfeeding. And I think that's something that Six Dimensions has been doing. So we actually have a few Facebook Live sessions next week. So there's one on the 31st, which is actually going to be about Black partners in the breastfeeding space. We'd love for anyone to join us for that conversation if interested. But I think, finding, free access points that are easy to join, there's not a lot of pressure around them, are a great way to also encourage families to even just start thinking about breastfeeding or other difficult topics within, the maternal health space.
Thank you for sharing those insights, Libby, and we'll definitely talk about those Facebook Live events towards the end. So, Nakeitra, I do have a question about what Six Dimensions has done, but I think piggybacking off of what Libby has shared as solutions, this is a perfect time to ask, put some of the audience questions on the screen. There's a question, and I think to just give this balanced, robust view from Aishat A, and asks, what advice do you have for women who can't breastfeed, but there's just this pressure to breastfeed and they feel less of themselves when this happens, especially with the increased awareness on breastfeeding? So what advice do you have for them?
I'll definitely say, okay, yes, we absolutely support breastfeeding because we know the benefits of breastfeeding. But we support any way that a family chooses to nourish their child. And I say that because everyone's journey is different. Everyone's body is different. Everyone has so many different factors that play a role in whether or not they can either initiate or maintain breastfeeding for the period of time that they would like to. And so my advice, I guess, to answer that question is do what you know is best for your body and for your family. But, if breastfeeding is an option, maybe even try it and link to those lactation professionals in your community that can help support that journey if that is something that you desire. And then there's already enough things in this world to make us feel bad. Don't let this make you feel bad. Do what you have to do for your family and be okay with that.
Thank you. Libby, any other added response?
I think Dr. Burse touched on it well, but I think, working to not feel shame, and then as a society, not shaming women or families for whatever feeding journey they choose is critical. And I think just, again, considering, all of the policy support that's needed for breastfeeding just as much as needed for, families that have unique feeding journeys. So making sure that, formula is safe, accessible, and affordable. I think those messages go for any type of feeding journey. And like Dr. Burse said, there's so many societal pressures out there. And if you are, feeding your baby and nourishing yourself, that's what's most important at the end of the day.
Yeah. So then could you then elaborate, because Libby, you had mentioned, breastfeeding spaces and, the role of the employer. So could you elaborate a little more on the role that an employer plays, especially in that sustaining breastfeeding, specifically addressing the Black community?
Yeah, I'll start on this and then let Dr. Burse jump in as well. But there are a lot of breastfeeding friendly initiatives at a hospital level, but there's also certifications that job sites or employers can work to have to be breastfeeding, friendly or certified spaces. So making sure that there's private space, not, a dirty bathroom stall, but like an actual space that women can go privately to breastfeed. That we have worked as an organization to put some recommendations and standards together for employers. So it could be, a very small room that has a comfortable chair. It's even nicer if, employers offer, some bottles of water or snacks in there for women. But I think just really considering that women have private, safe, secure space, but also the time. I think, there shouldn't be pressures that if women are, going to pump during the day, that they have to like make up that time later, or it's taken from like PTO or something. Or for some employers at all, they don't offer any of the above. And that's why women's journeys stop. If it's, going to cost them their job or their employment, that's a really tough decision to make. So women should just have this right and not have to make a tough decision at all about whether or not their breastfeeding journey can continue. It needs to be a right for women, returning to the workplace. And it shouldn't be a cause of fear or discrimination.
Yeah, thanks, Libby. So speaking of bright spots, one of our audience members just talked about how, the role that the society plays in encouraging safe breastfeeding spaces. Like they said in the UK, you have lots of restaurants, malls, public spaces that have signups for breastfeeding. So Nakeitra, then what role has Six Dimensions played in just, increasing awareness for safe breastfeeding spaces, or at least comfortable breastfeeding spaces in the community?
Yeah, and that's the second part to what Libby was talking about for businesses. So she spoke to the employer side.
Yeah.
The other piece of that is the patron side. And so if I'm going into a restaurant or any type of, open area, they need policies that will support breastfeeding. Now, some spaces go as far as creating, I've seen shopping malls that create beautiful spaces, but there are some that don't have anything at all. I've been in a dressing room and breastfed before. And so that's critical. If you're out and about, on your daily life, you've got to feed. And so what we have done, we're continuing to work on a breastfeeding friendly toolkit so that employers and places of business have a resource to help them put policies and practices in place to be able to support breastfeeding families, whether they're an employee or a patron. But we've also created some videos online for employers, and they're on our Facebook page, I think, on just the importance of having a breastfeeding friendly business, not just for employees, but also for patrons. And so that video is on our page, and I may be able to share it in the comments, but it's just a short video talking about how the business owner, who is also a Black woman, thought it important to be able to not only support her employees, but she was on a breastfeeding journey as well, three times. And so she knew that was important for her business model, but she also wanted to be able to support, those patrons that came in. And so we just use that as an educational tool, hopefully for businesses to look at, but also, like I said, we're working on creating a toolkit that will support businesses as well.
Perfect. Thank you for sharing that. So then, Libby, the question is, we've talked a lot about, designing programs to educate mothers. Where do you think this education should begin, and what are the different platforms for disseminating this educational activities?
Yeah, I think that's a great question. I think, the short answer is it's never too soon to start educating someone. And so I think, there aren't a lot of opportunities for sexual and reproductive health education in school systems in the United States. So I think, changing that narrative and programming at a young age can help, for longer term behavioral changes and adoption of very healthful behaviors. I think just in general with health programming, though, we have to think about creative places to educate. It can't always be in higher education or school systems. We have to think again about access and comfort and cost. So I think, as Dr. Burse said earlier, looking at even using barbershops or, highly trafficked places that are culturally relevant and comfortable are critical in providing messaging around certain health behaviors. So I think if we focused only on traditional modes of programming through like a school system, we're going to miss a huge part of the population. And so I think we also need to consider with any like programming around breastfeeding, or maternal health, how we're also integrating mental health components in that as well. the postpartum journey, women are susceptible to a wide range of emotions. Postpartum depression and anxiety can also be a real challenge. So I think in any of the, opportunities we have to educate women, we have to think about how we're also considering some of the mental health challenges that they might face. And I also just want to reiterate, when we're thinking about, programs for the maternal health space and when to start them or where to integrate them, as we discussed earlier, these conversations also have to include men from a young age. I think starting that acceptance and that conversation early on with male counterparts, with adolescent males around why breastfeeding is important, or other topics within the maternal health space, they need to be allies and advocates for women. And so I think having those conversations, not just as they're traditionally targeted towards women, needs to be a broader gendered conversation around this as a health behavior. So I think, just in summary, looking at better integration of health programming in more unique settings is critical. I didn't touch on it, and I should also mention that telehealth, again, and like what we're doing today, finding virtual opportunities that are low cost or free resources for people to learn is critical. I think that's really been a positive that we've seen from the COVID-19 pandemic, is finding more opportunities and resources and platforms to offer education for people, when, again, they can tune in live or they can listen to a recording. You can access from a smartphone, a computer, and have that resource without having to go to a class or a physical space or pay something for it. So I think really finding a balance of, creating that social support and community resources, but also more free resources that are highly accessible, is really critical in these conversations.
Thank you so much for your insight, Libby. So, Nakeitra, can you tell us a little bit about 6 Dimensions? What motivated you to start? What are your major focus areas? And what's your personal and professional vision for it?
Yeah, so we started in 2016 really as consulting. I had a long career in nonprofit, just, working in nonprofit programs, program director, program manager. And I love nonprofit, but I wanted to move in a space to help other nonprofits and to really exercise some of my program planning and development skills. So I went out and did consulting, and the vision has always been to improve the health of communities. But as we continue to progress, and when I left my job in 2016, and I must say that much of my nonprofit work was in sexual and reproductive health. And so this maternal health work is just an evolution of that. But in 2016, when I left my job, my sister ended up having a very severe case of preeclampsia. It resulted in preterm birth, and after 8 months, her baby died. And then that same year, my sister-in-law had she delivered early, and she passed away after 3 weeks. And so then those 2 cases in 2016, me having just quit my job, going on into this journey of entrepreneurship, but it was also coupled with another instance in my family in 2003. My aunt died 5 days after giving birth. And so I kept saying, okay, I don't know if this is just a weird kind of, instance for my family, but if this small microcosm is in my family, then that's a sign that there's a bigger issue in the world. And with all those 3 cases, there were, pieces of the system at play that could have, potentially saved their lives or improved their conditions. And so just started thinking more about that and what our role would be in that, and not just, honoring the lives of those lost, but also how do we prevent it from happening even more. And so we started producing a film. We started working on it in 2018, and that's Laboring with Hope. And then I think aired in 2019. And so that's when we shifted our focus to solely work on Black maternal health. And so all of our work, we don't do anything right now that's outside of Black maternal health. And I think we'll stay there for a while, but we have grown. Libby is a part of our team. As y'all can see, she's our numbers person, our research person. So excited to have her. But our vision is to be able to just innovatively put out solutions for the world to utilize to improve Black maternal health outcomes, and to do it without the social pressures of trying to walk a fine line that or having to tone down the things that we say. We know racism is a part of this, and so or the root of it. And so that's how we do all of our work. And that's our vision. Just we want to see mamas alive and give them great birth and labor stories that we don't often hear from Black women.
Thank you so much for that. It really speaks to your tenacity, to your dedication, to your motivation. I'm sorry all of those tragedies had happened to you, but it birthed a organization, a mission that is changing the lives of plenty of women and many women in the mostly in the Black maternal health space. So thank you so much for all you're doing.
Yeah, echoing Faisa, thank you for sharing your very inspiring story. As we said earlier on this channel, part of our goals is also inspire the next generation of leaders. So, Libby, tell us what inspires your work.
That's a great question. And I think for me, one of the biggest issues, I think, keeps me up at night and motivates me to do what I do each day is just whether it's in the United States or globally, I think everyone deserves the right to safe, affordable, accessible healthcare. I'm most driven by the maternal infant health space, and especially as we look at the United States, one of the wealthiest countries in the world, the fact that a woman can cross state borders and the status of her health outcomes can change drastically. The status of, what resources she has available can change, and how she's even perceived by society is a real problem to me. And it's something that we need to continue striving to do better at as a US society. As we see so many countries around the world working tirelessly, through, different channels to promote women, whether that's through government or, improve health outcomes. We're seeing a really different story here in the United States and a bit of a downward trajectory in the maternal health space. So for me, I think, ensuring every woman, no matter her race, her socioeconomic status, sexual orientation, geographic location, has those rights to a safe, birthing environment, safe reproductive resources, and just healthcare overall is critical. And so that's why I'm, incredibly fortunate and excited to be working with Dr. Burse in 6 Dimensions. I lived in Mississippi for about 3 years and was, truthfully shocked at the state of maternal health there, and saw challenges I faced as a, privileged white woman, and could not imagine how, so many women were being, mistreated, and just not able to access the same resources I had. So I think that really motivated me to seek out work in this space and continue to try to be the best advocate and ally I can be. So that's just a bit about, my journey and what inspires me to keep working in this field.
Thank you, Libby. We're just about wrapping up, but I see one question that I would like us to take, and this is from Carol Donwald. It says, since public policy impacts resource availability, what can be done to influence the needed political support to improve accessibility for all issues in maternal health?
I'll start with that. From the federal level, I do believe there's movement. Of course, our vice president was one who worked on the Momnibus package, which was a package, of course, of I think about 13 bills that were more comprehensive around improving maternal health outcomes. So it wasn't just about like the health care of mothers, but it was like about the wage gap and so many other policies. I'm encouraged there. But it's the state level policies and political support that is much harder, especially for us in a state like Mississippi. We have not expanded Medicaid, and nor in this past legislative session did we extend postpartum care to 12 months. Our state has a maternal mortality review committee, as do 40 something other states have. Our maternal mortality review committee was a legislative mandate. So we provide those recommendations to our policymakers. The part of it that is disheartening is that those, I don't know what, it still doesn't move them to understand that this issue needs a stroke of a pen could improve so many health outcomes in our state. And so what we have tried to do is continue to just push. We've gotten further than our state has ever gotten with expanded Medicaid. We last year initiated a ballot initiative process, which it did end, but that was closer than we've ever gotten. We also continue to push around that postpartum extension bill. And I know that is the floor. That is just the basic needs. But we worked so hard, revived it, almost got there. But one person, our Speaker of the House, had the power. And so when we talk about influence and the political power, I think it's making sure the right people are in those seats to be able to make these changes that we need. Because as long as we have the leadership, of course, that we have in Mississippi, it will be a very uphill battle. And we will have to continue to like pick these very, and I hate to say low hanging fruit, but these very small battles that we can try to address. But in the grand scheme of things, it doesn't have to be that way. So I think influencing the political power means in changing the powers that be for us in Mississippi.
Thank you so much, Nakeitra. As Libby is well aware, we talk about who has a seat at the table and who is essentially, making decisions. So, hopefully 6 Dimensions is also working on like the policy aspect of it. So I know we're wrapping up. We did have a question earlier, but I believe it was addressed talking about how to increase education amongst family members. And you had mentioned using different, communication platforms, social media. And also as we wrap up, we really want to thank you for celebrating Black Breastfeeding Awareness Week with us. It's definitely been an absolute pleasure and privilege to have you both. And also want to really thank my co-host Faisal, who works, arduously in the maternal health space as well, especially on a global scale. So we want to use this as a platform to continue to spread the word about 6 Dimensions. So how can people reach you? How can people support your work? Please share that with our audience.
Yeah, we are at 6DIMS, SIXDIMS on every platform. That is Facebook, Instagram, Twitter, and LinkedIn. And you can go to our website and join our mailing list. And I think following us on social media, really, that's a way to engage with our work in any capacity. And we have an amazing team. They're all over our social media. Can reach out to them if you are looking to partner. We evaluate maternal health programs. We engage in formative research or for programs as well. So if you are looking for evaluators, we do that work too.
Perfect. Thank you. Anything to add, Libby?
No, I think Dr. Burse covered it really well.
Yeah, and you had mentioned you have a couple of Facebook Live events upcoming. So what are the dates for those?
Yeah, so Monday it's at 6 p.m. and they are actually talking to some Black lactation professionals on Monday. So it's around breastfeeding and lactation professionals having that conversation. And on Wednesday, the 31st, we're talking to families and understanding the need for the Black male support in breastfeeding. And that's at 6 p.m. as well.
Perfect. Thank you so much. So for everybody, our live audience, for our speakers, thank you so much for joining us on Public Health in Real Life today. Don't forget to like, subscribe to our channel. Please give us feedback on, key topics you would want to hear. Once again, Libby, Dr. Burse, thank you so much for joining us. And thank you, Faisa. You all be well and stay safe. Bye.
Thank you so much.